So the surgical termination of pregnancy, what we abbreviate to STOP, does vary based upon the patient's gestation. So up until about 9 weeks gestation, the procedure will involve passing a plastic tube, a flexible catheter, into the uterus. And this is generally 5 or 6 millimetres in diameter. And using that catheter, we will then apply a manual suction syringe to remove the products. Beyond 9 weeks, some dilation is required for the procedure. So the cervix is dilated, and this is achieved using metal dilating rods. And these will allow you to pass a larger tube, a larger catheter, which is often rigid, into the uterus. And at that stage, we will probably apply an electronic vacuum system to gently remove the products from the cavity. Beyond 12 weeks, because the dilation can become a little bit more, we will often pre-medicate our patients prior to the operation. So this will involve usually buccal administration of a drug called misoprostol. So the tablets are placed into the gum space, just in there, and they generally sit there and dissolve over 2 to 3 hours. In some countries and in some public hospitals, they may choose different routes of administration for misoprostol, and that can even include placing the tablets vaginally for a number of hours before the operation. That drug softens the cervix, which significantly makes the procedure safer. Now, that drug does take 2 to 3 hours to work, and after that time, we will then perform the procedure as before with dilation and a rigid catheter. After that, we enter the sort of what we call the T2, the later terminations. And these aren't performed by myself, but are performed by a colleague, and they are certainly a bit more complex. In the aspect that procedure may involve a feticide. It may also involve the placing of dilators, or what we call osmotic dilators, into the cervix. Time then between that and then a subsequent procedure, a couple of hours, or even the next day later, where the tissue is removed. So essentially, under 12 weeks, the procedure is very simple, very quick and straightforward. It becomes a little bit more complex between 12 and 16, and then after that there are some further technical aspects that have to be considered.
Medical abortion involves basically bringing on the equivalent of a miscarriage. So I think there is some misinformation about what medical abortion is. To some people, it might be seen as you just take a medication, the pregnancy goes away. So I think it's really important that that women do understand that this is an induced miscarriage. So it is important, very important, that we know how far the pregnancy is or the gestation of the pregnancy, because this procedure is only available, it's only authorised, that medication in Australia, for a pregnancy that is 9 weeks gestation, which means 9 weeks from the date of the last period. So that will usually involve an ultrasound scan. There will usually be some blood tests done beforehand. We generally like to do a blood test on the day that the medication is taken, so we can then use that as a baseline to monitor that the medical abortion has been successful. The procedure itself is in 2 stages of medication. So the first medication is taken as a tablet, and that medication ends the pregnancy and prepares the uterus and cervix to then expel the pregnancy, which is what happens in some pregnancies with a natural miscarriage process. The second step, and the medication that we use actually is called MS2-step and reflects that there's 2 different stages. The second step is taken 36 to 48 hours, so a day or 2 later, and that's the step that then causes the uterus to contract and expel the pregnancy. So at that point, when the second medication is taken, fairly shortly after, usually within an hour or so, women will start to have cramps and bleeding. The cramps can be quite painful, and the bleeding is expected to be heavier than a normal period and does involve the passage of clots. So women will bleed with clots, usually just for a matter of a few hours. They may notice that they pass some tissue. They may even see the pregnancy sac after it's passed. So at that time, they need to be somewhere private. They need to be supported by someone who can both emotionally and physically support them should they need that. They need to have access to a bathroom. Generally, it's probably a good idea to have children minded elsewhere, just to create that space for those few hours when that miscarriage is taking place.